Distinguished guests, colleagues, ladies and gentlemen, good morning. My name is Sabiha Isaac. I am the chairperson of the Global Respiratory Infection Partnership and the South African Research Chair in Antibiotic Resistance and One Health at the University of KwaZulu-Natal in Durban, South Africa. Welcome to this regional workshop to develop the roadmap for antimicrobial resistance action by pharmacy in the region of the Americas. I'm very honored to share this platform with Doug Burgoyne from the US and Eduardo Savio from Uruguay. A little more about my co-facilitators. Doug is currently Adjunct Associate Professor at the University of Utah College of Pharmacy. His previous roles at Veridicus saw him manage clinical pharmacy functions and programs alongside disease management for self-funded employers. He was also founding member of Utah Aware, and an antibiotic resistance education program for the state of Utah. Eduardo Savio is the president of the Pharmaceutical Forum of the Americas and served as the chair of the FIP Policy Committee on Antimicrobial Resistance in 2018. He's also head of the Nuclear Pharmacy Research and Development, specifically in the pharmaceutical chemistry and biomedical areas at the Uruguayan Center of Molecular Imaging, and is a member of the directive board of his institution. So welcome to the two of you. I will begin with a brief overview of the workshop objectives. Doug and Eduardo will then facilitate an interactive session to develop the roadmap for action by pharmacy in the Americas, and I will then end the workshop with an overview of the next steps. So these regional workshops for you when this workshop was being held. I want to assure you that the recording of this workshop on the 12th is available on the FIP website, together with the other webcasts and videos. The recording of this very workshop will also be available on the FIP website immediately after this session. The objective of this workshop is to work together to drive regional initiatives in AMR by translating policy into action. During this workshop, we will co-develop and make a commitment to a regional roadmap for AMR success in pharmacy. GRIP is honored to partner with the International Pharmacy Federation to drive AMR action in a new decade by pharmacy. So the question is asked, why pharmacists? To answer this, I want to draw on the pentagonal framework of the Global Respiratory Infection Partnership. This framework speaks to the role of policy, prescribers, pharmacists, and patients on the prevention of antimicrobial resistance. Please allow me to go through each one of these parameters. The first is policy endorsed by local governments and clinical communities of practice that advance antibiotic stewardship and conservation. It includes patient empowerment and education about the appropriate antibiotic use and symptomatic treatment options. It provides pharmacy guidance on their stewardship role as educators, providing patients with advice and support on infection management and when to consult a doctor. It also includes prescriber guidance on antibiotic stewardship and effective dialogue with patients, and all of these together prevent resistance by the rational use of antibiotics. Being a pharmacist, and still with no bias at all, I believe that pharmacists are pivotal in this framework because, firstly, pharmacists validate or confirm prescribing practice and thus have tacit oversight of the prescribers. They are strategically placed to educate patients and affect behavior change in patient demand for antibiotics. Pharmacists are critical to the implementation of policy as well as the generation of evidence to inform policy-related interventions. And finally, pharmacists prevent antibiotic resistance by impacting on prescribing practice, patient behavior, and policy implementation. So those of you that attended the workshop on the 12th of September will remember that we decided to focus on 3 of the 5 strategic objectives of the Global Action Plan on Antimicrobial Resistance. These particularly resonate with the policy and practice roles of the pharmacists. They are strategic objectives 1, 3, and 5, specifically to improve awareness and understanding of AMR through effective communication, education, and training, to reduce the incidence of infection through effective sanitation, hygiene, and infection prevention measures, and to optimize the use of antimicrobial medicines. We also spoke about these in the context of education, policy, and public health, and incorporated this into the COM-B model. Now, the COM-B model, we wanted to specifically incorporate the COM-B model because we believe that the pharmacist has immense capability, opportunity, and motivation to prevent, contain, and mitigate AMR. Pharmacists have the capability to address AMR because they have the knowledge, skills, abilities, or proficiencies acquired via education and practice. They are motivated to prevent, contain, and mitigate AMR and eliminate it as a public health threat. And finally, they have the opportunity to achieve this by leveraging country commitment to the United Nations Declaration and the Pharmacy Association's commitment to the FIP policy statement on AMR. So these regional initiatives can address education, policy, or public health in any and all of the 3 strategic objectives of the Global Action Plan. So let's get the interactive part of this workshop going, and it's question time. The very first question is as follows. Has your country approved a national action plan? Please answer yes, no, or I don't know. Those of you that are intimately involved with antimicrobial resistance will know that the World Health Assembly resolution was passed that every country would have to have a national action plan on AMR by May 2017. While a number of action plans have been approved and can be found on the World Health Organization library of national action plans, there are a number of countries that are still developing them, and even more countries that are yet to implement them, although they have been approved at country level. So let's look at what the Americas say about whether they have national action plans. And the results are, about equal numbers of you say yes and I don't know, and a small number say that you have yet to develop your country action plans, national action plans on antimicrobial resistance. We can't emphasize more how important this is, especially as antimicrobial resistance is escalating in all areas and exacerbated by the COVID-19 pandemic. So the next question speaks to the role of pharmacy. So has the role of pharmacy been clearly defined in the National Action Plan on Antimicrobial Resistance? So those of you that have said yes, that you do have a National Action Plan, can you tell us whether pharmacy is explicitly mentioned in your National Action Plan? Please answer yes, no, or I don't know. In my experience, generally the tasks or the interventions are assigned to the ministries broadly, Ministry of Health, Ministry of Agriculture, Ministry of the Environment, and very seldom are specific professions identified in these national action plans. So let's wait for the results. And about a quarter of the national action plans do include pharmacy very clearly, and a little more than a quarter say pharmacy is not explicitly identified, and then a number of you say that you don't know. So those of you that don't know, please look at the WHO website and look at the Library of National Action Plans and see if your country is included in there. So thank you very much for that poll. In this workshop, we would like to populate the slide with the roadmap and as many initiatives as possible, after which we will identify timeframes as well as responsible entities. It now gives me pleasure to hand over to Doug and Eduardo to lead the rest of the workshop. So thank you all, and I look forward to administering the Q&A section at the end. Over to you, Doug and Eduardo.
Okay, good morning, everybody. Thank you, Sabiha. I'm very pleased to share with Doug on behalf of FIP. Thank you to Cello Health, that the support has been great along all the process previous to this meeting, as well as FIP staff. So in this slide, we share the survey results. Thank you very much to all the participants who has given the feedback in order to know what is the real situations. And so 5 key barriers were identified education and training, ongoing education and robust training models and implementation of MIR mitigation strategies for pharmacy in local setting is lacking. This is causing a disconnect between global objectives and operational execution. The second key barrier that was identified was in terms of financial resources and institutional support, that despite National and Global Action Plan, AMR, is not considered an urgent health concern for many governments. Consequently, public expenditure on AMR mitigation strategies is deprioritized, leaving pharmacy with pure institutional support and little funding to address the issue. The third key barrier was recognition and collaboration. And so globally, there is a lack of acknowledgement of pharmacy and its association with patient outcomes. As such, there is an overestimation of doctors' capabilities in MMR mitigation, resulting in a lack of motivation for collaboration between pharmacy doctor, hospital, academics, and policymakers. Next, please. The survey indicated also that 47% of our responders were unaware or not actioning with the objectives outlined by the Global Action Plan on MRR. So this is quite an important result from the feedback that we receive. The four key issue barrier was accountability and leadership. We know that this is very important globally, but specifically in our region, it is something that we have to pay attention. There is a clear lack of accountability regarding the implementation and monitoring of MR strategies that is causing a gap in leadership. This is generating local ambiguities and low levels of commitment to further global and national objectives. And the last one is in terms of regulations and surveillance. This is also a key issue because little regulatory practices and lack of robust policy frameworks for antibiotic prescribing has created a barrier to curbing inappropriate antibiotic use. So in this term, poor encouragement to increase surveillance from regulatory bodies creates issues with reuse, sharing, and improper disposal of antibiotics among patients. Please, Doug, can you take the floor?
You bet. Thank you, Eduardo. And it is a pleasure to be with all of you today. Thank you, Sabia, for the beautiful introduction. The survey insights for the Americas region, I think, are very interesting. First, a few comments. From the United States, we see this comment: accountability for patient outcomes still not associated with pharmacists. I think that's very true in the United States and probably throughout the world, where patients and healthcare systems, including national governments, are relying upon physicians and other caregivers for accountability related to antibiotic utilization, and pharmacists are not yet a key part of that organization. So there's room for pharmacists still to be accountable for patient outcomes. From Ecuador, we heard it is not a priority issue for governments. I think this is also true in so many places around the world. The entities associated with health, unfortunately, are aligned with government thinking. Their hands are tied. I think that's true. Interesting how antibiotic resistance and the appropriate use of antibiotics and encouragement of non-antibiotic symptomatic relief is something that falls down on the list of government priorities as other things rise. And unfortunately, AMR gets lower and lower on the list each year. So there needs to be some serious reflection of governments in terms of the priority of AMR and protecting antibiotics for future use. And then from Uruguay, we need to implement what is outlined in regulations and ensure that prescriptions are required for antibiotic dispensing. Monitoring the use of antibiotics at a national and regional level is important, alongside promoting the PROA program. Now, isn't this the truth? It's so easy in so many parts of the world for a patient to walk in to a pharmacy complaining of sore throat or some other generally virus or cold related symptom, and be able to receive an antibiotic. Where if antibiotics were more tightly controlled, then the belief is, and I think the data shows, that antibiotic resistance goes down, and we retain the effectiveness of antimicrobials for a longer period of time. So these survey insights highlight three of the most common conditions related to AMR. Next slide, please. As Eduardo and I considered the Americas region, recognizing that there is very broad diversity from south to north, using the framework that Sabia described in her introduction, looking at key action areas on the left-hand side of this chart, strategic objectives of the Global Action Plan on AMR in the center, and then some suggested initiatives on the right. We came up with these. So these are suggestions from Eduardo and I, and in association with the FIP and GRIP. We would like your reaction and discussion about these suggested initiatives for our region. So I'll just, we'll switch exactly into this. Perfect. So Eduardo, I'll turn it over to you for a discussion about each of the initiatives.
Thank you very much. In terms, these first two initiatives are related to education, which is in the sphere of capability in the model that has been proposed to work with. And so the first suggested initiative says in an introduction of training at pre-graduate level through the interaction with the Executive Board of the Pan-American Conference Pharmaceutical Education, sponsored by PAHO. You know that PAHO is the regional office of WHO for the Americas, that during the last 30 years, a bit more, this conference has been sponsored, and there are a reference for pharmaceutical education in the region. So the suggestion is to work with the executive boards of these important organizations that has a direct access with the deans of all the universities where the career of pharmacy is delivered, and to introduce this concept of training at pre-graduate level. The second initiative in terms of education is giving support to...
Sorry, Eduardo, can we vote on, can we poll?
Okay. Thank you, Sabija. So I ask, okay, for Carola to deliver. Now you have 30 seconds to give your opinion on relation to this initiative and whether you consider that it could be managed in 2021, in 2022, 2023, or 2024 onwards. Please send us your opinion.
While people are doing that, I just want to highlight the fact that the World Health Organization has developed a competency framework and associated curriculum for the education and training of the health workforce, specifically doctors as prescribers, pharmacists, nurses, as well as lab personnel. So we already have guidelines in place, and I'm sure that the Education Board would use that going forward. And over to you for the results.
Oh, okay. So we have 24%, that 24% that think that this could be managed next year. The biggest number is in 2 years from now, 2022, 33%, and a similar number, almost 30%, 29%, that it could be managed, delivered 2024 onwards. So thank you very much for your feedback. The next one is related in giving support to specific training for pharmacists. We know that even the previous result from the survey, that an important number, near 50%, were not fully aware of what was stated in the National Action Plan. So I think there is still much place to deliver a specific training on this area, especially in retail pharmacists And this it could be done through the Pharmaceutical Forum of South America. Next 7 September, we will have our action plan for next year approved. And so it would be a wonderful opportunity to introduce a specific training for pharmacists. What do you think? Please, Carola, can you deliver the poll? Thank you. So we have again, whether you agree and in which year do you think it would be best to deliver this kind of support for our colleagues? You have 30 seconds to choose your option. There are plenty of possibilities of courses that already are available from GRIP Group and from different, here we have the results. So the main figure is that 54% thinks that it is possible to be done next year, and 21% in 2023. Then the third option would be in 2 years, and in the less amount is 8% in 2024. So I think it's really an initiative that people would like to be delivered next year.
Yeah, that's great.
That's great.
Okay, we'll keep moving into the next area of our suggested initiatives. The first is participation of national pharmacist organizations of week awareness, focusing on these issues. So if there is, and I'm sure there is, a pharmacy week in your country, could we use that week as a platform for focusing on antibiotic resistance? And what we have here in the middle column, reduce the incidence of infection through effective sanitation, hygiene, infection, and other prevention measures. So if we can have the poll, please.
To also add here, besides the pharmacy week, I think us pharmacists can play a very strong role in the World Antibiotic Awareness Week that is held at in the middle of November, as well as the hand washing day. I forget which month that's held in, but also sepsis week and things of that sort. Wherever antibiotics are used, wherever infections can happen, wherever we can play a role in highlighting how infections can be prevented, we must take the leadership and be there to be able to show that pharmacists are as visible to do these things.
Absolutely, Sabia, I agree with you 100%.
So your results, this seems to be low-hanging fruit, Doug.
Yep, for some reason the results are not showing up on my screen. Do you see them, Sabia?
Yes, sorry, I do see them. So the vast majority of people say that these can be instituted by next year, 84%, and the remaining 11%, well, 11% say 2022. So this is really going to be implemented between 2021 and 2022. And I think already lots of countries are doing all of this anyway. So that's great.
Outstanding. Our second initiatives, and Sabia, I'll ask you for some help on the polling question again. The second question is to promote patient counseling in community pharmacies with emphasis on non-antibiotic symptom relief for viral infections. While you're taking the poll, I think this is really an important area for pharmacists to have a significant impact on our patients and on the populations in our communities. As pharmacists are the front line for most people when they're starting to feel ill, we can have pretty significant impact on the way that they understand viral infections, and that antibiotic is not generally the answer, but instead some symptomatic relief might be helpful. Watchful waiting is helpful, and appropriate use of antibiotics instead of running to them for every symptom is the best approach.
So Doug, can you see the results of those? No?
I cannot.
Yes, okay. I can see. Yes.
So Eduardo, would you like to just to follow on with the results, please?
Yes, a great majority believes that we have to pay attention to this next year and between next year and the follow. And so I think that we have to pay attention to this important issue.
I think it becomes particularly important in the COVID pandemic. It's also a viral infection for which there is no antimicrobial treatment at the moment. And we do rely on symptomatic treatment, especially in the vast majority of COVID patients that are non-severe and managed at a community level.
Absolutely, great points.
Okay, and then the third area has to be with public health motivation and also with the optimization and use of antimicrobial medicines. And one important initiative would be to support the creation of PRO approach, which this means programs for optimizing the use of antibiotics in hospital pharmacies. While the poll is delivered, I would like to mention that unfortunately, this is not initiative in place in all the countries. We have wonderful examples from Costa Rica and Ecuador that are on the website of this activity and that I recommend to go through them. Okay. Well, again, 42% of the participants believe that we have to consider this initiative for next year, and more or less a similar number, 38% in 2022, 13% in 2023, and 8% in 2024. So it would be an initiative to be developed in the next 2 years. And finally, the last suggested initiative is to promote antimicrobial dispensing is performed under medical prescriptions, and an important issue is to support policy enforcement requiring prescriptions for antibiotics. Could you please deliver the poll? As Doug said, many countries have already the legislation, but the verification and reinforcement of the risk requirement is not fully in place. So there is still initiatives that could be done to have it. Thank you very much for your feedback. Sorry, 68% believes that we have to take this into account next year, and 21% in 2022, and the rest in 2024 onwards. So now we have a clear idea of what is your belief on relation to the 6 initiatives that has been put into consideration. Doug, please. Okay. Now we have to choose which of the 3 initiatives do you feel will be most impactful for your region, for your country. So you have 6 options: introduction to training pre-graduates, then the support specific our colleagues, the participation in National Organization of the Week of Awareness to promote patient counseling in community pharmacies, the support the creation of the PROA in hospital pharmacy, or support policy enforcement. Please, you have to select 3 initiatives that do you feel will be the most impactful for the region or at country level.
Thank you, Eduardo. I apologize. I had a little technical difficulty with my computer there.
Okay, no problem. It happens.
Always at the worst time, though.
Yeah. We are prepared, luckily, Doug.
Yeah, thank heavens.
Ah, great. This is okay. Please, Doug.
Yep. So for the poll results, thank you everyone for participating. The question was, which of the three initiatives do you feel will be most impactful for your region or country? And you could select three. And it looks like number one is with 63% is promote patient counseling in community pharmacies with emphasis on symptomatic relief treatments. I think that probably is the easiest avenue for pharmacists to engage and have immediate impact on the health and welfare of our communities. Second was the introduction to training at pre-graduate level sponsored by PAHO. Agreed. Now we can implement through our colleges of pharmacy and through pharmacy technician training immediately more education around antimicrobial resistance. Then we saw our number three in terms of highest priority or initiatives that could have the most impact would be support policy enforcement requiring prescriptions for antibiotics. Absolutely. I think as communities enforce policies that are already in place in most countries around requirement of prescription for an antibiotic, our utilization would go down. Pharmacists would be seen as more of a counselor instead of simply a dispenser of medications, and patients would have better outcomes in terms of their symptomatic relief as well as treatment for their viral infection. So good results there.
Yes, I would
The
like
other
to also, please, Doug, sorry.
No, I was just going to say the other, the last three were also very good. So good support around specific training for pharmacy through the Pharmaceutical Forum of the Americas, and then support the creation of PROA in hospital pharmacies. And then our initiative that felt would have the least impact on this poll is participation in National Pharmacist Organization Week of Awareness. Interesting. For pharmacists on this poll to put that as third or as last. But certainly the top three I support 100%, where those are areas where we can have the most impact on our country and our region.
Yes, I agree that this has been an excellent feedback, and that even we have almost 5 important suggestions, and those that are in 4th and 5th place, they could be managed complementary in the action plan, in our roadmap. We can take a time to pay attention to all these initiatives. So we are happy that they have been well received, the proposals.
Absolutely.
Okay. So your participation has been wonderful. I think we are happy that the suggested initiatives have been well received, and now we have an idea of what is your opinion. Next, please, Sabiha.
So thank you very much, everybody. You really added value to the development of the roadmap for the Americas. We want to say that this is not, these are just merely initiatives that we thought about as we were planning for this particular session. And we really want to encourage you to identify other initiatives that would be equally important in the region of the Americas. We note that there is a disparity in the socioeconomic status of each of the countries, and that there would be a range of initiatives that would be required across all of the countries in the region. So please use the chat box and use the Q&A as box to add things to the session. So Doug, I've got a number of questions that have popped up here as part of the chat, and Eduardo, as well as from the previous ones that I think require some discussion on our side. The very first question, maybe I will take a stab at answering that, is a colleague from Canada who says 82% of antimicrobials are used in agriculture. They're used to treat or control or prevent disease caused by microorganisms and to improve production, growth, or reproduction. Agriculture accounts for approximately 82% of all antibiotic use in Canada. There are some concerns around their use. Are we focusing our energies in the right place? So I agree with you that antibiotic resistance is a One Health issue, and that we cannot address it only in humans without giving equal or equitable attention to antimicrobial use in animals, and specifically food animals, in crops, in plants, on fruit, and the collateral damage on the environment as all of the antibiotics and the antibiotic resistant bacteria and genes are washed out into the environment. There are a number of really good papers on the One Health issue and how it is imperative that we work on all three components of the One Health triad, human, animal, and environment, simultaneously, because there is irrefutable evidence that there are transmission dynamics between humans and animals, animals and humans, humans and the environment, environment and humans, and so forth. So I hear you. This is a human-focused symposium. But you're very right in that it has to be addressed on all three fronts of the One Health triad. Doug and Eduardo, would you like to add a little bit more to this? And then I've got 3 other questions for you to attend to.
Okay. No, your answer has been complete for me. It's wonderful.
Yeah, Doug? I agree. We certainly do need to look at animal health and the use of antimicrobials in the animal population and in farming. In our state, for example, we worked very closely with Department of Agriculture and encouraged the appropriate use. However, and unfortunately, the political landscape for food producers is a strong area for them, and they've been able to sway politicians to continue to allow the use of antibiotics, at least in the United States. So I think that will be more of a public issue, and we need more and more citizens to reach out and demand food that has been raised in an antibiotic-free environment. So but I agree with, yeah.
Just to add that the political issue in the US, but within the low and middle income countries, it's a food safety and a food security issue. So the farmers in the low and middle income countries do not have the resources to invest in biosecurity, good animal husbandry, vaccination, etc. And what happens is that as the demand for meat protein or animal protein goes up, so does intensive farming, where lots of animals are within confined spaces, which necessitates the use of antibiotics for animal health, for prophylaxis, for metaphylaxis, etc. So we're using antibiotics instead of investing in vaccination programs, investing in biosecurity and good animal husbandry. And if we can make the parallel to areas where there is not adequate services or water supplies in hospitals or poor infection prevention and control, again, antibiotics are the fallback position as opposed to good policy and good practice. So thank you for that. The question that I have...
sorry, John, only to say that from in the chat box, Philip Howard had mentioned a website, a link on relation to the agriculture use of antibiotics that I recommend to go through this link to those who are interested in having more elements about this issue. And also I would like to address an issue that has been delivered from Argentine, Sir Sosimo. She's a colleague that she is wearing, and she also believes that one of the main key actions is to reinforce through community pharmacy the requirement of prescriptions.
That's absolutely great. Thank you so much for that. So the question that I have to both of you speaks to broadly antibiotic alternatives. It speaks to symptomatic treatment that we've already mentioned as part of some of the initiatives, but also vaccination and water sanitation and hygiene. So could you possibly speak to those 3 components of alternatives to antibiotics: symptomatic treatment, vaccination, and good water sanitation and hygiene practices?
I will address one of the issues and the other 2 for Doug. One is in terms of vaccinations. Unfortunately, we have only 4 countries that they have already vaccination programs that involve community pharmacists in part of the programs that are Canada, USA, Costa Rica, Argentina, and partially in some state of Brazil. So there are members organization of a specific country that would like to develop and go through this road. So from FIP, we have enough place to support these countries that would like to establish immunization programs through community pharmacy. So because it's such a huge task to be developed, and we, with no doubt, we can support them to put this action into place.
That's great. Thanks, Eduardo. I think on the symptomatic relief, this is, as we said before, an area where pharmacists can have significant and immediate impact on the care of our patients. As the front line, pharmacists generally see patients or people suffering from viral or other cold and flu symptoms first before they see their physician, even if it's in passing as they come into the pharmacy for something else or for a family member. And so as a patient explains their symptoms, then it's a natural opportunity for pharmacists to engage with the patient, talk to them about the course of illness and viruses versus bacteria, to teach them that viruses are not treated by antibiotics. And the best thing they can do is rest, get plenty of hydration, and then treat their symptoms with non-antibiotic therapies. The benefits of the symptomatic relief have been shown in several studies. At the same time, it comes down to appropriate use and making sure that the patient gets the right type of therapy, and then also hydrates and rests so that they can be relieved. I think of all years, as everybody on this call knows, we're much more aware of symptomatic relief, of vaccination, hopefully, and then of the third point, clean water supply and sanitation, and how important sanitation is to public health. That's a little bit beyond the scope of pharmacy, but encouragement of hand washing, of appropriate sanitation pre and post exposure to individuals, wearing masks, and taking the right steps to avoid spread of illness, not just in a year like this one, but in every year. Then we can have a significant impact on the reduction of viral transmission, and we'll have a healthier community.
Thank you very much, Doug and Eduardo. One question that has come up a little in a number of the sessions today is the upskilling of pharmacists in antimicrobial resistance. Now, without revealing my age, when I was a student, we had one single lecture dedicated to antimicrobial resistance, and that was in the golden age of antibiotics. When one didn't work, there was always a pharmaceutical company developing another one, and we had a proliferation of classes and subclasses and synthetic derivatives, etc. And nobody really cared about antimicrobial resistance because there's always somebody working on it. So what happens to the people that did not have education and training within their undergraduate time, but now have to deal with this whole pandemic of antimicrobial resistance and are not necessarily equipped with the background information and the evidence base, etc., to be able to address it? So how do we upskill those of us that were not taught about antimicrobial resistance when we studied to become pharmacists?
Well, that's a great question. I think there's two phases to that. First is pharmacist education, and including more courses as required courses for pharmacists as they go through pharmacy school. And not just at the beginning. So if pharmacy school is 3 or 4 years, then we need to be talking about antimicrobial resistance each year, not just 1 year. The other part of this, Sabia, though, is the other frontline workers that are in the pharmacy that are interacting with our patients, and those are pharmacy technicians. And we need to do a better job of teaching our pharmacy technicians and the other staff that is working in the pharmacy to know more about AMR, the significant public health threat that it is, and that people need to be aware that antibiotics are a limited resource. We think about it, like you said, where we've always had an antibiotic, and for the most part, everybody has always been successfully treated with antibiotics. Unfortunately, we know what the future could look like if we're not more prudent in our use and use alternatives when an antibiotic is not appropriate. So I think that teaching our pharmacists is one thing, teaching our pharmacy technicians and other frontline staff is also important.
And Doug, would you agree that both the pharmacists as well as the pharmacy technicians have to be taught how to deal with patient pressure?
Oh,
Yes,
absolutely.
yes. Sorry, Doug. I agree, and also I think that there are even having many options, free options of courses related to this issue. We don't have enough in Spanish or Portuguese, so I think that we have place to translate and to adapt into local terminology what is already available in English initiatives, and to adapt to our expressions in the regions, and mainly that the technicians plays a very important role in the pharmacy, and as Sabiha was saying, how to react and to respond under the pressure of the patient and the community to have not appropriate use of antibiotics. So we have to manage these situations, and you had to translate many sources that are already available into specific language modalities.
Well, that's such an, yeah, it's making the information useful for the community is so key to success. Yeah, so I agree, Sabia. This is an area where there is a lot of pressure. I mean, we understand the pharmacy is in the community. The pharmacy technician and pharmacist are neighbors and friends of the patient and only want to relieve their symptoms and help them. At the same time, they need to have a satisfied customer so that the patient will come back to that pharmacy, and that puts a financial pressure on the pharmacist. And so being able to teach the patient about antibiotic stewardship in a nice way and help them understand why they don't need an antibiotic, but could use some other symptomatic relief therapy, then the pharmacist still can help the patient, relieves the tension that is between the patient and the pharmacist staff, and results in better antimicrobial stewardship.
Excellent. I think I want to just pick up on one point.
Only one. I have read in the chat box a message from a colleague from Costa Rica, Jose Pablo Diaz Madrid, that he says that he is working. We are aware that there are many people in different countries working. They will be welcomed in to support the roadmap that we are starting, and we invite everybody who are working for next week that the AMR Commission will be launched, and there will be much space to everybody to work. I know that there are individuals who are working, and we are happy that this is happening.
Absolutely.
So, thank you very much, Eduardo. Just to pick up on what you said regarding patient pressure and the importance of messaging and giving the message in the right way, we really have to consider the health literacy levels. We speak to patients differently from the way in which we speak to our health professional colleagues, and we speak differently to them as we would speak with the policymakers. So it's really channeling or adapting the message to the different audiences that we speak to. I've got a very good question here from Nora Khat, and I hope I'm pronouncing your name correctly. There are big gaps in the pharmaceutical legislation in our countries. I think that initiatives must give much importance to health authority regulations, and she wants to know what the panelists think about that. Pharmaceutical legislation and its implementation, please.
Yes, absolutely. I agree with Nora's suggestions. The legislation, the framework is not appropriate in many countries. Even the governments are not fully aware of that. This is not that they need to be updated. And so this would be an initiative, and it's clear that the opinion of our colleagues is in these directions. from the feedback that we have received today. And so we have a nice and interesting direction to work to support the update of the legislation in each specific country.
Absolutely. You know, physicians generally know when a patient is suffering from a viral or a bacterial infection based on the community and what's going around at the time. Pharmacists know and can educate people, but we need to have alignment with policymakers and with legislators to have a rational and comprehensive approach that everyone can understand in terms of antibiotics requiring prescriptions and the preservation of antibiotics for the future.
Sorry, I was muted. The very last comments, 1 minute each for both of you, is to think about behavioral changes, please, in terms of removing perverse incentives, speaking to antibiotics without a prescription, and we've already spoken about patient demand. So it's behavioral change in terms of removing economic benefits or incentives, but also curbing this supply of antibiotics without prescription. Please, Doug and Eduardo.
Well, thank you, Sabiha. It is a huge issue, and the behavioral change is one of the most difficult things to be addressed because we only think it's like an iceberg. We only think what is outside water, but there are so deep belief under the water that have to be taken into consideration in order to change behavior. So this would be something quite important to be addressed in the next future.
Yeah, absolutely. I agree. That is really difficult, and communities need to be educated at the same time. It happens individually, but while we're teaching patients one-on-one, we also need to be educating communities so that word gets around and people are supporting each other. In terms of the perverse incentives, man, there are many different conflicting incentives around antibiotic use. We have still in some places workplaces that require a person to be on an antibiotic before they come back to work. Same thing with childcare. So then the parent is incented to get an inappropriate antibiotic so that the child can return to school or to childcare. We have the incentive, the financial incentive of dispensing an antibiotic to someone, and the revenue that the pharmacy makes. There are other incentives that go around in terms of satisfied customers, and it is a difficult situation for us. So I think the solution is that we tackle one problem at a time. And so the financial incentives can be created by selling non-antibiotic symptomatic relief, and then public health education around when to return to work without an antibiotic would be most helpful and can be done as part of Pharmacy Awareness Week or any of the other weeks that we talked about before.
So thank you, Eduardo and Doug. I'll let you off the hook. There are one or two questions that I'll take very quickly myself. There's one comment from Philip that says some community pharmacies have increased business by not supplying antibiotics as word has got around that they give really good advice without selling unwanted medicines. So this is a behavioral aspect and also an understanding by your customers that medicines are not necessary for every kind of ailment. Or antibiotics are not necessary for every kind of ailment. We've got a question regarding the importance of the use of procalcitonin in advising in terms of whether antibiotics are needed or not. Procalcitonin is a good marker to differentiate between viral and bacterial infections, and it also gives an idea of the severity of the infections. What we do need is more rapid point of care diagnostics to be able to ensure that when we do prescribe an antibiotic, it is really warranted and we are prescribing it for a bacterial infection. So with that, I will say thank you to Eduardo and Doug for an excellent discussion. Thank you very much for your input.
Thank you, Sabiha.
You're very welcome. And I would like to now end the session with our next steps. Sorry. There you go. So our next steps are, first of all, we're going to publish this global roadmap after taking into consideration all of the inputs from all of the 6 workshops we are holding in the 6 WHO regions. Catherine Duggan announced the FIP AMR Commission and made mention of the FIP development goal related to antimicrobial stewardship at the workshop on the 12th. I would like to encourage every one of you to attend the launch of the FIP Commission. It's going to be on the 24th of September at 1 p.m. European time. This is where we will have a panel discussion and discuss what the terms of reference are and what our deliverables are going to be. The very first deliverable of the FIP AMR Commission will be the regional and global roadmaps for pharmacy. The next slide, please, Erin. So we really look forward to your continued engagement with the roadmap, and we especially count on you to implement it in your countries and regions. What we've done today is identified key actions and engendered regional commitments to AMR action in pharmacy. The roadmap is meant to be a living document, an iterative tool that will act as a compass to guide actions globally, and we hope to sustain the momentum and evaluate progress in pharmacy. It will be revised annually, and it will culminate in a presentation at the FIP World Congress in 2023. That's going to be in my home country of Cape Town, and you're all very welcome, where we will hold a special health ministers summit during that FIP conference. So we please ask you to continue to engage with us, engage with the FIP AMR Commission as it is launched, and we look forward to your inputs and your contributions as we go forward. And finally, in closing, I would like to acknowledge all of the people who made these workshops possible. Catherine Duggan, the CEO of FIP, for advancing the antimicrobial resistance and antimicrobial stewardship discourse within FIP. Adrian Shepherd for his visionary leadership of GRIP. Jane, Aaron, Ashlyn from Cello Health, and Carola and Susanna from FIP, and also Mila for your invaluable support. Without your support, we would not have been as successful in delivering 6 workshops within 2 days. Doug and Eduardo, thank you very much for your co-facilitation and your excellent insights. And finally, thank you to all of the participants. Thank you for your time. Thank you for taking the time from your work days to participate in this workshop, and thank you for your invaluable contributions. The contents of the chat and the Q&A will be downloaded and used as we move forward with the regional workshop. So thank you all very, very much, and have a good day further. Goodbye.